Hi, this is Dr. Kathleen Hallinan, and we are continuing our weight loss vlog. Today I'm going to go over several things. One is the issue of genetics and obesity and how much are you predisposed based on your genetics. The second is the change to the pediatrics guidelines, and the third is how the Lumen works. So to start off with, on January 1st, when all of us were making our New Year's resolutions, there was a segment on 60 Minutes on obesity, and I thought this will be great, very helpful for everyone. However, it was very unhelpful, and I'm going to tell you why. The two doctors that were interviewed are Harvard physicians, and they stated that the primary cause of obesity is genetics. And moreover, they said that you can throw willpower out the window. Now, both of these physicians are advisors to Novo Nordisk, which is the company that makes two of the largest most successful recent medications that are used to treat obesity. And they said this in the middle of the segment, that Novo Nordisk was additionally an advertiser on CBS's 60 Minutes. So this basically took a whole journalistic segment that should have been very informative to the American public on obesity and turned it into a big infomercial for Novo Nordisk and the medications that they make for obesity. Now, I think everyone will acknowledge that there are certain genetic loci, meaning small genetic bits, that increase your predisposition to obesity if you are exposed to a bad food environment, lack of exercise, those things. Some people will have a higher risk then. However, to state that the primary cause of obesity is genetics is something that I would state that certainly is deceptive and is not doing anyone any good at all. As a matter of fact, I would say that this would make Darwin roll over in his grave. So we're calling BS on this here, and I have to tell you guys that I don't want you to be frustrated by this. They have done studies where they look at people who are told their genetic predisposition, and this often makes people give up in the sense that they eat worse and exercise less. So in the process of kind of researching this, I actually found a great summary article in the Lancet that was written by Dr. Mark Goodarzi, who is a professor of endocrinology at Cedars-Sinai in Los Angeles, California. And he basically sets out all of the genetic risk data. There are so many studies that have shown that lifestyle intervention is not substantially modified by the genetic risk. A SNP, an SNP, which stands for a single nucleotide polymorphism, SNP, is a measure of, these can be used to make risk calculations. And so, for example, in the diabetes prevention program, which was a very large study looking at lifestyle intervention on obesity and diabetes, they had a 16 SNP genetic risk score, and it did not have any impact on the success of people in that study. So there was the Nurses' Health Study, which showed that physical activity actually attenuated the association between a 32 SNP genetic risk score and their BMI. So while genetics plays a risk in your susceptibility, it is not the primary driver of obesity. And this is a real problem with the pharmaceutical industry driving the dialogue in our country, and the media just becoming basically an advertising arm for them. So I'm going to caution you, really be careful when you're listening to the messaging that's going on, and do not fall prey to what you're seeing. The second issue is the change in the pediatrics guidelines. I am not a pediatrician, but the pediatrics guidelines recently came out offering, after intensive lifestyle change and modification, that surgery and medications should be offered to adolescents 13 and up. While I think this is a good option for people who are certainly at high risk, we have to remember that lifestyle interventions still need to play a pivotal role. And if you take medication or if you have bariatric surgery and you have not even gone through puberty yet, we really don't know the long-term effects on this in people who have not really matured genetic or from their hormone axis yet. So keep this in mind. Still, lifestyle intervention has to be front and center. So behavioral change is key. And we're going to go look at actually this. So we'll go over the Lumen, which is kind of an interesting little strategy. I do not have a Lumen. They're $300. But the physics behind it is very, very fascinating. There is a great YouTube video called I think it's called The Physics of Weight Loss. And it's really super entertaining. This guy goes through all of the physics and calculations behind how you actually lose weight. And if you'll notice, if you're burning carbs, which a carb is 6 carbon, 12 hydrogen, 6 oxygen, you get 6 carbon dioxide that you exhale. But if you're burning fatty acids are a much larger molecule, and as you burn fatty acids, you get way more carbon dioxide that you blow out of your lungs. You also get a lot more energy. ATP is a measure of energy, so you get a lot more energy out of a fatty acid than you do out of burning a carbohydrate. And the Lumen is a little device that you blow through, and it essentially measures your respiratory exchange ratio. And it kind of then does a calculation and so gives it to you in a more understandable way, and a way that you can modify your behavior to make it so that you're essentially more often in fat burning mode than carbohydrate burning mode. So it really is a neat little adjunct to help if you really need that push to your change in behavior. So I would encourage you you can look at this. Again, it's $300, which is kind of steep on the expense side. If cost is not an issue, then it certainly might be a helpful gadget. But again, only if it's going to make you change your behavior. So the other thing, again, that is still key is going to be to just check your weight a few times a week and use that so that you know whether you're being successful, you're losing, or if you're going in the wrong direction. Then you want to change whatever strategy that you're using currently and modify your behavior, okay? So, and make your behavior changes, again, so small that you can't fail, whether that's changing one meal at a time. So change your breakfast so that it's a little bit healthier and it's a little bit more lean in terms of proteins, a little bit less carbs, a little bit less calories. So change one meal at a time. Change one snack decision at a time. You don't have to change everything. Change one thing at a time. I have had people recently who the only thing they did was they stopped drinking soda and their weight started coming down because that was such a driver for them. Make small, regular, sustainable changes. If there's something in your diet, if you're kind of a big Starbucks junkie or a big Dunkin' Donuts junkie and you're getting foo-foo drinks, then you might want to limit those to once a week. These are huge calorie loads. Basically, it's like, you know, have some coffee with your sugar. So look at like whatever is your the big culprit for you and see, hey, can I tweak that a little bit? Can I adjust that? If I'm making, you know, a dinner, can I modify that so that it still tastes good? Maybe instead of using like butter or cheese on your chicken, maybe you can just use a rub. And like they're really great. You can flavor things with rubs, and that's hardly any calories, and it's very healthy. And then you have that with some steamed vegetables, and that's way better than having your chicken with cheese and butter with pasta, because you've just made small changes and it still tastes good. So and it's filling and it's healthy. So try to keep it to non-processed foods, lean proteins, vegetables, fruits, and try to stay away from anything that comes in a box or bag that's processed, okay? So you guys are doing great. I hope you're all really empowered and feel that you can make a difference. You should feel that way because you can do that for yourself, okay? The pharmaceutical industry and the medical community is going to make money off people who are not healthy, and the healthier you can get, the better it is. And we would like to have you, if you need the medications, use the medications. Talk to your physician, talk to your provider. They are absolutely helpful adjuncts to your lifestyle changes. And then actually, as you succeed, then you get to come off the medications. And that is the best part of my day, when I get to take somebody off their medications as they're doing better. Their sugar's coming down, their weight's coming down, their blood pressure's coming down. I get to pull them off the medications that they were needing. Okay? So you guys are doing great. Thank you.